Hello, I'm Dr. Dennis McKenna. I am so pleased today to be joined by our Dean, Dr. Alan Boulos. Alan, great to have you here.
Yeah, thank you for having me.
Of course, you've been here before.
A few times.
A few times for sure. Alan, of course, is the Dean of Albany Medical College. We're going to talk a little bit about you and what you do here in a moment. Today is Monday, June 23rd, giving you the update from Albany Med. And on a personal note, I'll say today is my oldest daughter, Kate's 21st birthday.
Happy birthday.
Happy birthday to Kate.
It's a big one.
Yeah, she's up at Double H and she's doing, she's a counselor up there. She's a unit leader up there, so very proud of her. All right, so Alan, I mentioned you're the dean. Everyone knows that. 18th dean of our medical college, right?
That's right.
Goes back to 1839. Been in the role now for over 2 years.
Yeah, 3 years.
Going on 3 years, right? Had the installation last year, lots of fun.
Right.
And a lot of great things happening. So I know you're very busy, obviously running the college and all of the mission inside the college, but a lot of things today that we want to talk about that I'm sure you could give us some update on and some insight into. Let's start with cardiology, cardiovascular services. Very important here, right? Very important. We know that there are certain services that we offer on the Albany campus in cardiology and cardiovascular surgery that are unique, right?
That's right.
We do adult and pediatric. We obviously do certain surgical procedures, emergency and elective that are done only here. And obviously some of that is business that's sent in from other campuses or from around the region. So two important individuals are joining that team. We'll start first of all with our new chief of cardiology. Dr. Syed is joining us. In fact, today is his first day.
Yes, Dr. Syed. He's a great addition. He's coming to us from Loyola. He is actually one of the pioneers in a field of cardiology called cardiac imaging. Historically, imaging is usually radiology driven and radiology read, but he went to NIH early on in his training and learned from the best on the future of cardiac imaging with MRI. And he's brought that experience to Loyola and his prior employment experience at other academic institutions. And has been a research leader in that space. And so we're really grateful for him to come here. He's going to bring this wealth of knowledge around cardiac MRI and the value it can bring to our patients to this region. Similar to, you mentioned the long history we've had. We were the first site to do angioplasty.
Correct.
This is another example of where we're leading the way in a different way today.
Absolutely, great hire. We welcome him on board, as we do for Dr. Soon Park, who is our new surgical director for our cardiovascular service line. Cardiac surgeon, extraordinary history and experience joining the team.
Yeah, he's another super addition and another leader who will be a major influence on the way we go forward across our system service line. He is a cardiac surgeon who has a history in academics for a long time. He worked at University of Minnesota, at Mayo Clinic, at Case Western. He deals with the sickest of the sick, the heart failure patients who need emergency surgery, the heart transplant patient who needs that emergent transplantation. And he's been doing that for his career with amazing outcomes. And so we are very excited to have him join us, teach us his thoughts and show us his ways. We have had continued progress and improvement in our current service line in cardiac surgery. In fact, our outcomes continue to improve and we're better than the state averages. And he's going to provide another perspective and another avenue of patients who we historically may not have treated here. He brings expertise to allow us to do so.
Yeah, I love the point you made at the end, and it's worth emphasizing that both of these individuals were obviously very excited to join the team. They're joining high-functioning, high-quality teams already, and so obviously just going to take that product and make it even better.
That's absolutely right.
Yeah. Let's change gears for a second. Now, Alan, you and I both graduated from Albany Medical College. I was a couple years ahead of you.
Yes, you were.
but we also trained together here as residents, right?
That's right.
Obviously, when you finish medical school, you do your training. Yours was in neurosurgery. Mine was in emergency medicine. Every year, we welcome a new group of residents to come here and be trained. Some are here for just 1 year. Some stay here for 7 years in training. Sure. And we're fortunate some of them actually stay on and practice here for many years. And you and I the other day welcomed the new class of PGY1s, postgraduate year one residents, into Albany Med.
Yeah, this is a really important month for us. June going into July. We get the new students, the PGY1s that arrive in anticipation of the July 1st start date, which has been there
Right.
since way before us.
Yes, forever.
Through the match process, and there were 107. I want to thank the GME office who did an outstanding job with the orientation, Dr. Asher,
Sure.
Dr. Warner, along with the group, Katie Riddle, Sue Swain, Heidi Blackwell, and Betsy Berg. All of them were very important in allowing us to have such a great turnout. There was a lot of enthusiasm. And I want to tell those residents that they're in a great place. You know, I want to segue into a faculty member who has really helped the residencies. Her name is Dr. Becky Stetzer.
Sure.
She's been with us a number of years, and she's really an extraordinary physician. She works in geriatrics and in the Alzheimer's Center. And in addition, she carries on this role as our Assistant Dean of Competency Assessment. And often she'll help either residents and sometimes students who are having difficulty with competencies, and she'll help them through a master adaptive learning process and that often involves the Sim Center, to help them get better and really join the workforce
Right.
and get back on track to graduating. In fact, you know, in all of the places I go, I often get remarkable comments about her skill set and how helpful they've been to the individuals. And I'll just comment, Dr. Inoue and Dr. Schimmel published a paper on the effect that she had on their
Yes, they
urology
did.
residency, and it was really quite remarkable. So really a great job by her. And she's going to be on the on today. She's going to be on the WAMC,
WAMC.
Medical Monday.
Medical Monday.
Yep.
So many of our faculty are on the radios and TV and newspaper talking about things. It's part of our mission, right?
That's
to
right.
educate the community on various things. So welcome to our new PGY ones. By the way, the total number of residents we have on the campus is close to 600.
That's right.
And I've heard you say they are a critical part of our workforce. They're here to learn, but they're providing direct care to patients. They allow us to do what we do around the clock 24/7. It's very important that we train them, teach them. We thank them.
Yeah, and so on that note, I want to say thank you to the graduating residents.
Right.
Many of them leave this month in
Right.
June, and they have served in incredibly well. Many will stay in our region,
Right.
either with us at Albany Med or
Right.
in our system, and we are very grateful for their efforts. I have to give a shout out to Dr. Morgan Spurgis and Dr. Andrew Rock. They're the neurosurgery residents that finished
Yeah.
their 7-year
Right.
journey. And Tessa Harland and Aubrey Rogers, who finished their chief years. All four have gone into different subspecialties of neurosurgery, which I think is remarkable, and they're the ones that help keep us on our toes and keep us engaged in learning and advancing the field of neurosurgery.
You said it best. You said it best. We'll change gears a little bit. Alan, have you ever seen the movie Jurassic Park?
I have, yes.
See it, right? Interestingly,
There's several, aren't there?
Yeah, there's many. A book written by Michael Crichton, who, by the way, was an emergency medicine physician, great
correct.
author, wrote Congo Sphere, a couple others. Anyway, makes me think about, you may have seen recently, there was a dinosaur egg
That's right.
that got brought into Albany Med, and they needed to do a CAT scan on it. Sadly, there was no dinosaur in there. But the reason I mention that is because they chose to use a CAT scanner at Albany Med because it's the only one in the region. One of the very few that does this. It's a 256 slice CT scan, and that's really the story, right? Not whether or not there was a dinosaur, but what does that CAT scan allow us to do?
So as you add more slices to the CAT scan, it speeds the acquisition. And that's particularly important in the heart, which is a moving organ.
Back to Dr. Syed.
And so now we can instantly catch those frames so that we can get a very beautiful cine or merged image. We use it a lot in stroke, and each time the slices improve, we get better imaging on that. And it gives us more accurate imaging as well. So it's a great tool. Pediatrics can be very
Pediatrics.
useful because children may not hold still, and since the pictures are taken so quickly, even while you're moving, the pictures can be sufficient. So it's got a lot of advantages for our patients.
And those pictures don't take themselves. Obviously, we have technologists who are very well trained, often specifically in CT, MRI, nuke med, who work really hard.
And to your point, the machines usually require more of those technologists, so they actually add some skill set to that.
So we thank those technologists. We certainly thank our radiologists for the work they do, because everybody who comes in here probably gets some form of imaging. Some get many, and that's very important for diagnosis, treatment.
Absolutely right.
Let's finish on this note. You may have heard, if not, you soon will see that we are partnering with a consulting firm called ECG Health Management. We announced this last week. This is an opportunity as a health system, which includes the Albany campus, Columbia, Saratoga, Glens Falls, and visiting nurses, to take a look at what we are today as a system, the types of services that we coordinate together, maybe in some cases fully integrated, and other areas where we're not necessarily, and whether or not we can move that with the idea of improving quality, improving access, and financially stabilizing and growing. And ECG is going to be our partner. There's going to be 3 particular workspaces. One will be looking at our strategic plan over the next 10 years, very important as a system. One will be looking at our corporate, and I will lead that effort. One will be looking at corporate services and where there's opportunities for us to do more together. That'll be led by our System Chief Financial Officer and System Chief Operating Officer, Fran Albert. And the third one, Dr. Bullis, you will lead, which is really about our provider and physician enterprise. And that's going to be an incredibly part of what we do when we look at things. So just want to first of all say this is an important engagement. You'll hear more about it. We ask for your support and help, but give you an opportunity to talk about it as well.
Yeah, I think it's, and you mentioned it, it's an inflection point in our path, in the organization. And a lot of good stuff has been done. Thanks to your leadership, Fran, Chris Couchet, Vic Becker, we have Workday and we have Epic in place. And I'll even, just for a minute, talk. I received a call from Glens Falls on a patient who had a very unusual stroke. And after the conversation, because we had Epic in place, because we had iSight, that radiology backbone in place, we were able to manage that patient there, which for the past 15 or 20 years, that would have been transferred to Albany Med. And so that's where we are today as a system. We're already able to use these neural networks, as you would say, to help support our patients get the right care at the right place through these tools. The next step is, how do we be one team with one goal? And that is still where we're going, and that's where these partners like ECG, they're a kind of another coach to help us get to that one team, one goal place, because we all are human, and so we tend to work where we are in our geography.
Right.
And so this is asking us to take that extra step to see our team more broadly, and I'm very hopeful, and I think we have a great path to do so.
That's perfectly said. Nothing I can say that's better than that. Thank you for that. Thank you for that endorsement. Thank you to those of you out there that'll help us work on this project over the next 12 to 18 months. So it's going to be a significant period of time, very important work, but thank you. All right, well, that's it for today. Anything else you bring to the table?
Got nothing.
You had a lot. We appreciate it very much. And as I've said before, we appreciate all you now more than ever as well. Keeping everything happening on this campus in the system, obviously for our community, we appreciate it. We'll be back again in 2 weeks, and we'll give you some updates then. And in the meantime, we ask that you please take care of yourself and take care of each other.